Your dog has been trying to tell you something is wrong, and you have been telling yourself it is probably nothing, probably just tiredness, probably just a phase, probably nothing to worry about. But here is what nobody tells you. The signs that send dogs to emergency surgery, to late-stage diagnoses, to outcomes that could have been completely different, almost none of them look dramatic at first. Almost all of them look like probably nothing. By the time this video ends, you will never look at your dog the same way again, and that might be the most important thing that happens to them this year. Welcome to Canine Guide. If you want practical knowledge that actually protects your dog, subscribe right now. Let's get into it. Before the 5 signs, one thing you need to understand, because without it, you will watch this video and still talk yourself out of acting. Dogs do not show pain the way humans do. This is not a personality trait. It is not stubbornness. It is biology that runs 15,000 years deep. In the wild, a dog that visibly showed weakness was a target. Predators selected for the ones who limped the least, who ate through the nausea, who kept moving through the injury. The dogs that survived were the ones who hid it best, and those are the dogs you live with today. Their pain tolerance is not a sign that everything is fine. It is a survival mechanism that was never designed for a world with veterinary medicine. Your dog will not tell you they are suffering. Your dog will carry it, and by the time they cannot carry it anymore, you have often already lost weeks of treatment window that you cannot get back. Keep that in mind for every sign that follows. 1. Drinking more water than usual. This one almost never gets noticed in time.
Because it does not look like a symptom. It looks like a hot day. It looks like they ran more than usual. It looks like probably nothing. Here is what it actually looks like medically. Polydipsia, the clinical term for excessive water consumption, is one of the earliest and most reliable indicators of several serious conditions in dogs. Diabetes mellitus, Cushing's disease, kidney disease, and pyometra, a life-threatening uterine infection in unspayed females, all present with increased water intake as one of their first visible signs. A study published in the Journal of Veterinary Internal Medicine found that polydipsia was among the top 3 presenting symptoms in dogs later diagnosed with chronic kidney disease, a condition where early intervention can extend quality life by years, but where delayed diagnosis often means the disease is already in its middle or late stages before treatment begins. The threshold to watch for is this. A healthy dog drinks approximately 25 to 50 milliliters of water per kilogram of body weight per day. If your dog is visibly returning to the water bowl more often than usual, if their bowl empties faster than it used to, if they are drinking from toilets or puddles when they never did before, that pattern over more than 2 consecutive days warrants a call to your vet, not a wait and see. The complicating factor is that most owners do not track their dog's baseline water intake. They only notice the change in retrospect, after weeks of it. Starting today, pay attention to roughly how much water your dog drinks. Not obsessively, just enough to know what normal looks like for them specifically, because normal varies by dog, and deviation from their normal is what matters. Do not scroll past point 2.
Because it is the one that gets dismissed more than any other, and it is the one most likely to already be happening to your dog right now. 2. Changes in stool that last more than 3 days. Every dog gets an upset stomach occasionally. A different food, something they ate on a walk, a stressful event. 1 or 2 days of loose stool or slightly different consistency is not a reason to panic. 3 days is. Here is why the timeline matters. The gastrointestinal system in dogs is remarkably efficient at recovering from short-term disruption. If the cause was minor, dietary, stress-related, a transient infection, the system corrects itself within 48 to 72 hours under normal circumstances. When it does not correct within that window, the cause is unlikely to be minor. What you are looking at after day 3 is a system that cannot resolve the issue on its own. The specific changes to watch for go beyond just diarrhea. Consistently greasy or shiny stool can indicate exocrine pancreatic insufficiency, a condition where the pancreas fails to produce adequate digestive enzymes, leading to progressive malnutrition even when the dog appears to be eating normally. Black or very dark stool can indicate digested blood from the upper gastrointestinal tract, a sign that warrants same-day veterinary contact, not a 3-day observation window. Mucus in the stool over multiple days can indicate inflammatory bowel disease or intestinal parasites that will not resolve without treatment.
And pale or gray stool can indicate liver or bile duct problems that are almost invisible from the outside until organ function is already compromised. A 2021 review published in Veterinary Clinics of North America found that owners who monitored and reported stool changes early were significantly more likely to receive a definitive diagnosis in a single vet visit compared to owners who delayed, reducing both diagnostic cost and treatment time. What you observe at home is clinical data your vet cannot get any other way. Use it. Stay with me. Point 3 is the most commonly dismissed sign of all, and it has a name that most dog owners have never heard. 3. Scooting, licking, or repeatedly biting the base of the tail or rear end. Most owners see this and think worms. Sometimes it is worms. More often, it is anal glands. And the reason this matters is that anal gland issues, left untreated, progress from discomfort to impaction to abscess in a timeline that is much faster than most people expect. Dogs have 2 anal glands, small sacs located on either side of the anus at approximately the 4 o'clock and 8 o'clock positions. These glands produce a strong-smelling fluid that is released during defecation and serves as a form of scent marking. In healthy dogs with firm stools, the glands express naturally with each bowel movement. In dogs with softer stools, with certain body conformations, or with anatomically narrow gland ducts, the glands do not express fully. They fill, they become uncomfortable, then impacted, then infected, then abscessed. And an abscessed anal gland requires surgical drainage, antibiotics, and in some cases ruptures through the skin before the owner realizes anything was wrong.
A study in the Journal of Small Animal Practice found that anal gland disease was responsible for a significant proportion of veterinary dermatology referrals, and that the majority of cases had been showing behavioral signs, scooting, licking, biting at the base of the tail, for weeks before the owner sought care. The behavioral signs were present, they were just misread. If your dog is scooting more than once or twice in a week, licking at the base of their tail with any regularity, or turning to bite at their rear end, book a vet appointment. Not an emergency, but this week. An anal gland expression takes minutes. An abscess takes weeks and sometimes surgery to resolve. And if the scooting is accompanied by visible swelling on either side of the anus, or if your dog is showing signs of pain when sitting or defecating, that is same-day contact with your vet, not this week. Do not miss point 4, because unlike the first 3, this one is invisible from the outside, until it is not. 4. Unexplained changes in energy that last more than a week. This is the hardest one to act on, because lethargy, reduced energy, reduced enthusiasm, less engagement with things that usually excite your dog, has 100 possible explanations, and most of them feel benign. It is hot, they are getting older, they had a big week, they are just in a quiet mood. Here is the clinical reality. Persistent lethargy lasting more than 7 days, with no clear external cause like heat, recent intense exercise, or a known stressful event, is one of the most consistent early indicators across a wide range of serious conditions.
Hypothyroidism, heart disease, anemia, Lyme disease, early-stage cancer, and tick-borne illnesses all present with reduced energy as a primary early symptom before the more dramatic signs appear that make diagnosis obvious. A paper published in the Journal of the American Veterinary Medical Association found that owner-reported changes in activity level were among the most accurate early predictors of underlying disease in dogs over 5 years old, more reliable in many cases than clinical examination alone, because owners have a baseline that no vet appointment can replicate. You know what your dog's normal energy looks like. Your vet does not. When you tell them your dog has been quieter than usual for 10 days, that is a data point they cannot get any other way. The specific pattern to watch for is this: not a single quiet day, not even 2, but 7 or more consecutive days where your dog is noticeably less interested in walks, play, greetings, or things that normally activate them with no clear situational explanation. That is a pattern, and a pattern warrants investigation. In dogs over 7 years old, any persistent change in energy lasting more than 5 days should prompt a call to your vet. Senior dogs have less physiological reserve. What takes weeks to become serious in a 3-year-old can become serious in days in a 9-year-old. One more sign to go, and this is the one that most owners notice, comment on, and then never act on. Make sure you stay for it. 5. Bad breath that has changed or worsened in the last few months. Almost every dog owner accepts bad dog breath as a given. It is just how dogs smell. It is normal. It is fine.
And in doing so, they miss one of the most accessible and consistent early warning signs in all of veterinary medicine:
A healthy dog's breath has a mild, neutral odor. It is not pleasant exactly, but it is not strong. When breath develops a distinctly foul, sweet, metallic, or ammonia-like smell, that change is information. It is not a grooming issue, it is a physiological signal. Here is what different breath odors indicate. A sweet or fruity breath smell in a dog that is also drinking and urinating more than usual can indicate diabetic ketoacidosis, a condition that is life-threatening if not treated rapidly. An ammonia or urine-like smell on the breath can indicate kidney failure, where the kidneys are no longer filtering waste effectively and urea begins building up in the bloodstream and releasing through the breath. Severely foul or rotten breath in a dog that is also reluctant to eat or has visible discomfort around the mouth is most often advanced periodontal disease, and the research on this is unambiguous. A comprehensive study published in the Journal of Veterinary Dentistry found that over 80% of dogs over 3 years old had some degree of periodontal disease, and that in moderate to severe cases, the oral bacteria responsible had been linked through repeated studies to heart, kidney, and liver damage through chronic systemic inflammation. The mouth is not isolated from the rest of the body. What is happening in the gum tissue is happening in the bloodstream. The action step here is straightforward. Start lifting your dog's lips once a week and looking at their gums and teeth. Healthy gums are pink and moist.
Red, swollen, or receding gum lines, brown tartar buildup on the teeth, or teeth that are visibly loose or damaged, these warrant a dental assessment at your next vet visit. A change in breath odor combined with any of these signs warrants a call this week. And if the breath change is accompanied by a sweet smell and increased drinking or urination, that is a same-day call. Now step back and look at all 5 together. A dog drinking more water than usual, stool changes lasting more than 3 days, scooting or persistent licking at the rear, a week or more of unexplained reduced energy, breath that has changed in smell or intensity. None of these look like an emergency. None of them will send most owners to the phone the moment they notice them, and that is exactly why they matter. Because the conditions behind them, kidney disease, diabetes, anal gland abscess, hypothyroidism, heart disease, periodontal damage, are all conditions where the difference between early and late detection is not just treatment cost, it is outcome, it is quality of life, it is years. Your dog cannot advocate for themselves. They will carry the discomfort, adjust their behavior around it, keep showing up for their walks and their meals and their time with you, and give you almost no indication that anything is wrong until they cannot anymore. You are the only early warning system they have. After today, you know what to look for. If this video helped you see your dog differently, share it with someone whose dog deserves the same. Subscribe to Canine Guide. We are here every week with the practical knowledge that makes you the owner your dog actually needs.